Right. Mankind, you're ready. Netcast, you're ready for the recording.
Yes, sir. If you want, you can go ahead, sir. We can start.
So, what is the order that we're going to follow today? Netcast, can you
Yes,
hear
sir.
me? Yeah. So, the order we'll follow is we will go with Dr. Amutan first, then Dr. Parle, and then Dr. Nizar. Is that what we're going to do?
Sir,
Always Parleji first.
I think he has to log off at 8:30, so we'll start with him. All right? Is that
Mahesh ji?
okay, Amutan sir? Is that fine with you?
I don't know whether the PPT and Word files I have sent is ready with Mahesh.
Yes, sir. Ready, sir.
Let him play that.
Fantastic.
Okay,
Good.
sir. I will
Dr.
share my
Parles is
screen,
also
sir.
ready.
Ha, sir. Both.
Sir, since he was requesting that he wants to log off, it is between batchmates, so we can't really interfere. He was requesting to log off
No,
early.
doesn't matter. Fine, Amutan, let Amutan present
Fantastic.
first. That's fine. That's fine.
Why?
Doesn't matter. They go slightly late. Doesn't matter. Yeah.
So, good evening, everybody. It gives me
Because
great
Amutan
pleasure.
had just received Lifetime Achievement Award in your course. So naturally, so great Amutan goes first.
How many lifetime achievements have you received?
No, nothing. I don't think I'll receive one in my lifetime at least.
Why?
No, I'm not as great as Amutan.
See, it is not given by us. It is given by.
Wonderful. So, it gives me great pleasure to host the evening, and we're going to start with a small presentation about Professor Amutan, along with his other batchmates, Dr. Parle and Dr. Nizar. And over to you, sir. We'll first play Dr. Amutan's presentation.
Is it playing?
Yeah, I can see the.
No, I'm not able to see. Yes, now I'm able to see.
What happened?
Just, sir, we restarting the video once again.
Yeah.
Just a wait, sir.
Any problem?
No, sir.
While he starts, sir, which years did you join? I'm just trying to fill in the time. From which year? It must have been in the
90
time
January
when
we
was 2
joined.
years.
90 January we joined and December 91 we left.
So it was 2 years in those days.
Yes.
Right.
Now it is a 3 years course, no?
It's 3 years.
3 years.
Since how many years? What batch it was? 3 years?
I think from around 2000, 99, 2000, it became 3 years.
That's okay.
Maybe
Yes,
earlier
we were
also,
the
I'm
last
not very
batch.
precise. Can we see the presentation from the first slide, Mahesh?
Yes.
Can you read the word
Hello.
point?
Yeah.
Hello.
Can you play, Mahesh?
I've already, sir, shared. The screen is visible to you or not?
Yeah, I can see it, but there is no sound. Didn't you put some?
Just a minute. I put the sound. I need to check.
Mahesh ji, while you are sharing now, please select share sound option. Click on.
Just a minute.
So you finished in 91 December.
Yes.
So faculty that time must have been.
Faculty wise, sir, just retired before we left.
Okay.
Sakru sir was HOD. Khatri sir was there.
Right.
And Dr. Bali sir,
Mother was
Jagmohan,
HM of Kshatriya
Chandrasekhar, and Dr.
Finally, the
Purohit.
video is playing now. We can watch
Yeah.
it.
Amutan, is that you?
Yeah, that is my father and my parents.
Medical College in the year 1970. His father developed stroke in 1971, which stimulated him to carry out further postgraduate course in internal medicine from Madurai Medical College, and finally DM Cardiology from the prestigious PGI Chandigarh after scoring All India second rank in the entrance exam. After earning his DM Cardiology, he developed special interest in the field of echocardiography and delved deeper into the echocardiography literature by attending various conferences, workshops. With the support of government of Tamil Nadu, he installed 3D echocardiography system at Government Rajaji Hospital, Madurai, in the year 2006. His first book on 3D echocardiography was published in the year 2011. He is the Fellow of American College of Cardiology, Fellow of American Society of Echocardiography, Fellow of European Association of Cardiovascular Imaging, Fellow of Cardiological Society of India, and Fellow of Indian Academy of Echocardiography. He became Scientific Chairman for Echo India 2015 at Bombay and was hailed for live sessions on interventional echocardiography. He became the President of Indian Academy of Echocardiography in the year 2015 to 2016 and organized Echo India at Madurai very successfully in 2016. During his tenure, he strengthened Indian Academy of Echocardiography by bringing out the most popular textbook of echocardiography by Indian Academy of Echocardiography. Now, second edition has been published, and he is working on bringing out the third edition. In the year 2016, he also participated in the annual conference of ASE, where he was incorporated into WASE Normal Study Group as principal investigator from India. Now, WASE Normal Study is the prime reference on echocardiographic normal values from India, in the age group of above 18, from the youngest to the oldest population. Under his tenure as president of IAE Madurai branch has received Best Chapter Awards for 5 consecutive years. He is at present the director of 4D echocardiography at Jayalakshmi Heart Center, Madurai, where he and his colleagues pioneer into 4D transthoracic and transesophageal echocardiography and strain analysis in coronary artery disease. As Professor Emeritus of Dr. MGR Medical University and Professor of Indian Medical Association, HQ, New Delhi, he has a passion for teaching echocardiography to young cardiology residents by live workshops and specialized classes. He popularly believes Seyyum Thorile Devam and is a classic example of poet Bharati's saying, Virven ena ninaithayo, always comes out of all the difficult times of his life by sheer hard work and perseverance. PGI Felicitation 2026, Professor.
Hello. Hello.
Yes,
Hello.
thank you.
Yeah, am I audible? Ha, sir. The video is done. So thank you, sir, so much.
Wonderful.
Hmm.
Parle sir, you have your video too? Mahesh?
No. I just gave my CV and some photographs to Mahesh.
Mahesh, have you made it into a PPT?
I think he has made something.
PowerPoint.
I think that
Mahesh,
was
have
shared
you
on the
made a
group. That was
PowerPoint?
he has shared
Hello.
on the group.
I have a sir PPT. Just a minute. I
So
will
let
share.
us put Parle sir's PPT also.
Yes, sir.
Nisar, how are you? Unmute. Unmute.
Yeah. How are you?
Fine.
Fine? Yeah.
Seeing
Very
Nisar
good.
after a long time.
Nice to see you. Huh? Old buddies.
Welcome,
1990.
Dr. Nizar.
1990. Yeah, that's.
Nisar, Dr. Ajay Swami, he is felicitating us.
Good evening,
Okay.
Dr. Nizar.
He
Nice to see.
is one of the masters of interventions in the country.
No, no,
I mean,
sir. Is very
I consult him whenever I have any problems. Ask any interview, he's done it. We are very proud of him. But he's a PGI alumnus, but he's doing excellent work in Hyderabad. He was initially in military hospital Pune, no? FMC. You are in FMC?
Yeah, I was
Yes,
prof.
he was in FMC,
And
FMC, and he's doing excellent interventional work in Hyderabad.
Good, good, great. Nice to hear that.
Yeah.
Today is your day, sir. Can I see Dr. Parle's presentation?
Sir, screen is visible?
Yes.
But it's blank.
Just I'm playing the video, sir.
Yeah, go ahead.
Hello. Yeah, thank you, sir, for sharing your valuable things, sir. Thank you so much.
Thank you. Thanks a lot.
Right, sir.
What are you going to do with the 50 lakhs?
I already spent 50 lakhs.
You have spent?
Yes.
50 jackets or what?
Yes, no, we have just recently we have developed one ECG machine and that wearable jacket. We have our own ECG machine now, which is undergoing regulatory approvals. That is a mobile-sized ECG machine. And shortly, maybe I'll incorporate some AI-based algorithms in it.
Excellent. Excellent. Dr. Nizar's presentation is also there, Mahesh?
Yes, sir. Just now I'm playing. Give me a minute.
Yeah, given. Parle sir, that is really wonderful. We're going to have some discussion on that as to actually, along with BL, we were trying to develop one for the armed forces.
Yeah, in fact, yes, that is meant for such remote places. We'll talk it after Nisar. Yeah.
We developed it, but then it ran into some regulatory authority problem, and then after having struggled with it for 3 years, I let it go. So, This is in 2011-12 because
Okay.
then we started getting the 3 lead ones and we started managing with that somehow. We just needed.
And this is a 12 lead.
Fantastic. Our idea was the same, that like you have the Mason-Liker modification for the
Yeah.
leads. We used to say
Hello, sir. Just
Mhm.
wanted to check.
yeah.
Sorry, sir, to disturb. Just wanted to check is video is visible?
No,
I
No.
played the
your
video.
screen is
No.
visible. You have to do a new
Just
screen share.
okay, sir. Just a minute.
Mahesh, you are as bad as we are as far as this screen is concerned, I see. This is called on-job training.
Mhm.
Yes.
Yes.
We see the screen now.
It's visible, sir.
Yes,
Yes.
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 Fantastic.
Thank you, sir, for sharing information.
Thank you, Mahesh. So your time in PGI at that time, we were just discussing who was on the faculty, sir.
So, for I think 1.5 years, Vahi sir was our HOD and director. Just
Right.
last 6 months, I think he retired and Sapru sir became HOD. And that time, for short time, Dr. Bidwai also had come from SGPGI. For maybe 3-4 months, he was there. And we learnt a lot, especially pediatric cardiology. We learnt the clinical part. He was fantastic, Bidwai sir. In fact, he used to put his stethoscope and make us listen to split sounds, the mid diastolic, early diastolic murmurs, and to diagnose those rare congenital heart disease. He was really very good in congenital midwife, sir. Nisar, you remember?
Yeah.
Hmm.
A great clinician,
Very great clinician.
and I would say the best I have come across.
Yes, really. Because that time, in fact, Gujral sir, when Vidwai was there, Gujral sir told us once that in 1970s, when echo was there, not there, Bidwai sir used to diagnose transposition of aorta clinically. And they clinically, he just with stethoscope he was diagnosing this, and they were using that doing that interatrial dilatations. So he and R.K. Tandon sir, who was our examiner.
Yeah.
Yes, very good clinicians. We learnt a lot during our examination
During
from
our
Examination.
exam,
Tandon sir.
in fact, I had there was one argument with him, and
I remember, Nisar, you had dilated cardiomyopathy versus pericardial effusion, right?
yeah,
That was your case. And
yeah,
you dilated it as pericardial effusion, but actually it was dilated cardiomyopathy, something of that
dilated.
sort.
But I
Right?
defended it.
And you defended it.
The-
And Tandon sir also was wrong. Both were wrong,
Wrong. Yeah.
right?
Yeah. But great teachers,
Very, very great.
and even in examination,
He taught us. He taught us.
taught us. Yeah.
Yeah.
Dr. Anand also you forgot.
Yes, Anand sir.
Yes,
Dr.
Anand.
Anand was. Yes,
Dr. Anand, he was there, and then he left for US.
last 6 months, I think he left for US.
US, yeah. And then we had these in the junior
Junior
faculty.
consultants.
That I told all this.
Dr. Jagmohan, Dr. Grover, Dr. Bali, Dr.
And Chandrasekhar. Yeah.
Great people, great people.
Yeah.
Dr. Jagmohan was really, I mean...
that then the pacemaker and those things we learned from him.
Yeah.
So what do you feel about that era and this era, sir? We will never have access to those kind of clinical deductive reasoning. We are just stuck with our multivalvular and...
Yes. See, in fact, we say I think we were lucky that we saw this transition of cardiology from clinical ECG, echo, color Doppler to coronary and coronary intervention and structural. Everything we are seeing, this transition we are seeing, and we grew with it. We used to do initially when I was doing my MD here in Sholapur, we were doing only 2D echocardiography. That time there was no Doppler.
No color Doppler.
No conventional Doppler. In PGI, we had conventional Doppler, no color Doppler. You remember? There was no color Doppler in PGI that time. We did only conventional Doppler. Then later on, we had color Dopplers when we went to our practice. So we grew with that. And in some ways, I think that has helped us in sharpen our clinical skills also.
Yeah.
The especially ECG and all, I think that made us look more, I think we can, as a holistic approach to the patient, not seeing only the investigations or not seeing only echo. I think that that's what I believe. I don't know, Dr. Ajay, you are in a younger era. Perhaps you might feel different.
It's nice to be called young. But I'd like a comment from you because you've been looking at echocardiography very closely from its inception, and you reached, a tremendous level of expertise as far as echo is concerned. How do you see the transition from a purely clinical-based diagnosis to now? I think most structural heart disease is, diagnosis is refined based on what you get on echocardiography. So,
yes.
Do you sometimes long for the days of clinical cardiology where, at least you had an idea of what you were going to find before you put the probe?
Yes. I think I still practice that in my clinic today. Without putting a stethoscope, I never take patient for echography. And I think that is very important because, see, very small VHDs, especially apical muscular VHDs, if you don't auscultate and get a murmur, you are going to miss on a very cursory echo. You are going to miss it. That's for sure. Then those AV fistulas, you are going to miss it. So I think we have to put a stethoscope before we. If you don't see a differential diagnosis, you are going to miss PDA with pulmonary hypertension, 100%. You are not able to diagnose purely on echo. You see a differential diagnosis on clinically. Like I have seen many times in my practice. I have seen many patients. The echo done by many cardiologists and PDA pH has been mixed because they have not noticed the differential diagnosis. So I think it's still is important to have a look at the patient and do at least quick clinical examination. Not a very, perhaps you may not say there is a long pre-dialysis with pre-systolic accentuation, mid-diastolic rumble, increasing inspiration, expiration. That may not matter. But murmur, which murmur sounds and quick clinical examination. I think that has to be there. What's your opinion?
Furthermore, I think clinical examination, it teaches you to focus on a disease. Suppose you auscultate, you find an early diastolic murmur. So you focus on aortic valve or pulmonary valve, isn't it?
Yes.
So otherwise, you're lost in that, ocean.
See, certain conditions like constitutive pericarditis, you can diagnose only clinically. You will miss it on echo, and this has happened. Right. This has happened.
No, it's fascinating. I think probably making a bedside clinical diagnosis should be a mandatory prelude before the patient is put on the echo table as a skill for practicing cardiologists. Sir, but I'd like you to weigh in, since you've been watching the discipline of echocardiography so closely for so many years, that do you think that it has changed so much that we should do away with the stethoscope now?
See, now all the practicing cardiologists, when they go to the visit to a particular hospital when for consultation or anything, they carry these handheld devices. I purchased one handheld device for my son.
These can extend from G.
And he became very successful with that. He has learned everything, and he became a very successful practitioner, and now he is doing dependent cardiology in one of the leading institutions. And he does echo very well because of that training. Initially, you have to have a clinical knowledge or clinical examination of the patient, and then put your probe, electronic probe. And that electronic probe has become a second step. First of all, is your step. And second step is your handheld device. Wherever you go, you just carry. And you got a confirmation right on the table. Make a clinical diagnosis. But for going for consultation, especially in some of the surgical setups, where they want the function, cardiac function, they mainly call you for the cardiac function. That setup, you'll require that additional electronic step. Is that all right, Parleji?
No, absolutely. No, it is essential. We need it. I'm not saying it is essential. But yes, without putting our conventional stethoscope, you should not put electronic stethoscope. That's my.
But you carry both.
Can I narrate one event? I think in my practice, long back, we got a patient, and that patient had an unexplained heart failure. He had undergone cath outside. That was inconclusive. At least 10 echocardiograms. Inconclusive. Nothing. So I happened to examine that patient. I just put my stethoscope on the back, and there was a continuous murmur. As I just moved my hand down, I am feeling a continuous thrill in the lower back. Then I went back into the history. He had a spine surgery, and then it proved to be a peripheral AV fistula, causing high output heart failure. He had been. So this is the importance of a clinical examination.
Clinical. Yes,
cath,
absolutely.
They were not, they just got high output features. He had received timing, he had received everything. So a simple clinical examination, it led me to the diagnosis. And then we got a CT angio, we did an angio, and then he was treated that AV fistula was device closed. So I think there is no substitute for a good clinical. You might have tens of, high-end investigations. Until and unless you know, your mind knows what I am dealing with.
Fascinating. Earlier, sir, some incident from your training that you stands out that you remember.
During the training hours, we never see sunrise and sunset.
No,
Something that is
the,
not
the only thing which
still.
Everywhere,
thing
every
which I
time you are in PGI.
Yeah.
See,
the thing
once
which I, that two incidents. Yeah.
my incident I will tell. My dean from Madurai came all over to PGI, and it was around 8:30 or 9. Our all fellows were there. I was taking as a rounds as the ward register and doing that. She came. She went to Kashmir and was returning or something like that. She peeped into our PGI and she was just wondering why this is not happening in Madurai. What do you do in PGI? Why all are working at this late hour? The full troop was there with me and we were doing rounds. She was fascinated. This is PGI. You simply have that working culture. That
Yeah.
culture helps you a lot in your life. That you develop automatically when you work in PGI. Don't you agree with me, Parleji and Nizar?
Yes, absolutely. One
Yeah.
funny incident only I'd like to narrate. You remember Raju George was our junior.
Yeah.
Yes.
Yes.
With
Oh,
Raju George,
yes,
we had
yes.
gone to post office. Remember Central Post Office. So that time, the first years used to carry all pacemaker generators in their bag. You remember? There are
Yes.
5, 6 pacemaker generators they used to carry in the bag because the pacing call used to come at any time in day and night. So used to always with like stethoscope, that bag was with us. So he carried that bag in post office, Raju George.
And left it there.
Remember? And he left it there. He forgot it there. See, that was 1990. There was a terrorist threat. There used to be curfew after 7 o'clock. And at that time, an unattended object was left in post office. Someone opened the bag. Someone opened the bag. This bomb. Bomb. In minutes, that post office was evacuated.
Yeah. Nostalgic.
Yeah.
I still remember once Amuthan was, we had this DM final examination, and Amuthan was to present his, I think, long case. Dr. Tandon, and there was another external examiner from, I don't remember his name, he was from Calcutta. And Sapru Saab was our internal, and Khatri Saab was our internal. And Amuthan is presenting, before presenting the case, he is telling, good morning, sir, for today's DM presentation, we have this. I think Amuthan must be remembering it. And then somebody, told him, this is not DM presentation. This is your DM presentation. This is your final examination. Amuthan, do you remember it?
No. Only you are going.
We had a lovely time there.
Yeah.
All the teachers were great. They were so affectionate. And we really, whatever we are today, we owe it to them.
Yeah.
I personally feel I owe it to them because they taught us, they caught us by finger and taught us what to do, what not to do. And
everyone was a
work
legend in the
culture
field.
and ethics was
Yes, everyone was a legend. Everyone
legend.
was a legend. Yes. See, Sapru sir also, that basic hardcore animal research, he was there. You remember that? He had PhD students, he was working on ACE inhibitors. Many ideas which he was thinking, they were realized later.
Yeah.
Anand sir, he had a heart failure. He used to do muscle biopsies in heart failures. peripheral circulation, heart failure. He had that time publications in circulation. Remember? In fact, whatever research publications which I intend to do or have been doing little research, I think everything I owe to PGI. Yes, everything. That research mindset, I think that has been inculcated only in PGI. I don't think any other institute you have that.
Other departments, sister departments, they were great. Cardiac pathology, doctor.
Yes.
What was his name?
Yes, he taught us cardiac anatomy.
Cardiac.
He was a Bengali.
No. It was, I think, his references were,
in Brownwald. They were in Brownwald. He was a Bengali.
Bengal.
Yes.
And how he
taught us cardiac anatomy with the actual specimen. He used to teach us congenital
He would get the specimens and teach us. Great people. And those Thursday
8 to 9 sessions.
Yeah, they were
8 to 9 sessions taught us a lot about the other
how much
specialties.
informative they were.
Yes. And everyone was afraid of that mortality meeting.
Mortality meeting. And how much learning there was.
Friday.
And the staff and the student CPCs.
Yeah.
Yes, staff, student CPCs.
Great.
Mortality meeting.
Mortality.
Some very rare presentations were from the other departments. Are they still there? 8 to 9 sessions in the morning in PGI?
Sir, it is more than 20 years since I left PGI, so I don't know. But I think last 5-6 years or so they have fallen away because the focus has become very much on intervention. So they have a large
full
number
PGI, all different departments they used to it was nearly compulsory. 8 to 9, not only cardiology. Everyone.
No, I think the Wednesday CPC is still compulsory for everybody. The staff CPC is still compulsory for everybody. But cardiology in my time used to have a morning class 8 to 9. That was mandatory for us. It was a cath meet every day morning. Whatever
we had only on Friday. And Saturday.
Yeah. It used
we had on Friday and Saturday with surgeons.
So that combined meet with surgeons was on Saturday. But the cath meet used to be there every day except Wednesday. And twice a week, there would be an afternoon, one journal club, one seminar.
Yes.
And one case for the exam.
Yes, from 12 to 1. From 12 to 1. No? It was from 12 to 1. Yes.
These were the teaching sessions. But I mean, as we have said, we never saw the sunrise or the sunset. It's great fun. Fantastic legacy, which is, incalculable value.
Yeah.
Shaped the careers of so many of us. And
yes.
To life and what we taught our students.
Yes. And I think, Smith has created this group. There is a good bond amongst us. Everyone helps. I doubt whether any other institution has that bond.
Yes, it's very nice.
That is because of Parleji.
My son has joined AIMS Delhi as an assistant professor.
Good.
Congratulations.
Congrats. So, Parley, you are really old.
No, I'm not old. I'm not old. I still practice for 13 hours a day.
13 hours?
Yes.
What do you do for 13 hours?
I examine around more than 60-70 patients a day. Do 6-7 procedures a day.
Mm-hmm.
So I'm not old, Nisar. Okay, I think
this is a great time after seeing after so many years.
Yes.
All three of us.
Yes.
All three of
Old
us
buddies.
met some 15
I think
years
one
back or
of
something like that.
one some India Live. I think we met. I think
We met, yeah.
yeah, India Live.
In Cardiac Society meeting or something like that.
Yeah, yes,
CSI,
CSA or India Live. One of the.
India Life.
Yeah.
So, Amutan, how busy are you?
I do the textbook work in the morning hours, and I do the intervention in the morning.
Mm-hmm.
Afternoon, I have my clinic where I do echo and the consultation and other things.
Mm-hmm.
It is going on. I am doing intervention in one of my classmates' hospital. He is having a big hospital, corporate here. I'm a consultant there.
Good.
And afternoon, I have my own echo machine and non-invasive consultation in the afternoon.
Mm-hmm.
Intervention I do in the corporate hospital in the morning.
Okay, that's good. Great.
Now,
Nisar,
when did
you are in
you
Srinagar only?
retire, Nisa?
Yeah, I am in Srinagar.
Yes, sir.
No, when did you retire?
I retired in 21.
21,
Yes, sir.
5
Yes, sir.
years.
5 years. Now.
Now, how are you feeling after retirement?
He's still in the private setup, no? You are in private setup.
Private setup, yeah.
Do you teach?
Busy.
Is Srinagar private setup well developed in Srinagar?
Yeah, it is coming up. Yeah, we have now nearly 7 cath labs.
Acha, in Srinagar?
Srinagar
Acha,
city,
okay.
yeah.
Okay.
In the peripheries, there are 2 or 3 cath labs. So
Acha,
doing
okay.
good job.
Acha, focus. Because earlier I think only Sher Kashmir was the only place.
Yeah.
Because I remember Shah was only a non-invasive man in private when he went into private.
He settled in non-invasive setup only.
Mhm.
Now, is Srinagar safe to travel?
Yeah, safe.
Nisar has been saying that it is safe to travel since 1990. I remember Nisar telling that when he can identify the sound of AK-47 that time. That time Nisar had told me, I can identify the sound of AK-47.
That era is gone now. No.
That era is gone?
Yeah, that era.
Good. For good.
Yeah. Horrendous times.
Yeah.
So, how many kids you have, Nizar?
Yeah, I have 3 kids, 3 daughters. 2 are married and one is studying in UK.
Mm-hmm.
Anyone in medicine?
One is in medicine, yeah. 2 are not in medicine.
In UK, she's in medicine, is it?
No. She is in anthropology, social anthropology.
Okay.
So, Amutan, what are your kids doing?
My son is doing dependent cardiology.
Good.
And daughter-in-law is doing MD General Medicine.
General medicine, okay, good.
Daughter is doing MS General Surgery.
General surgery.
My son-in-law is MS General. So, it is a love marriage. Both my son and daughter had love marriage.
Good.
My
So
son,
his son is in non-invasive and daughter is in invasive.
Daughter married a Muslim, intra-community.
Good.
My son-in-law is a Muslim.
Good.
So I don't. I am.
You are a true cosmopolitan. Good.
So what about you, Parley?
My son did his DM cardiology from JIPMER. Now, then he did his fellowship in electrophysiology. Then for a short fellowship in structural in Denmark. And now he has joined AIMS Delhi. Maybe for 6 months to a year he'll do it there, and maybe he might join me. The other son is doing his MD medicine.
So he will join you. You have your own hospital or what?
I am a director of one of the multi-specialty hospitals here. It's a 300-bedded multi-specialty hospital where I do my interventions.
Mm-hmm.
And I have a big non-invasive setup.
Mm-hmm. Good.
So he'll join me.
So it's in Sholapur or
In Sholapur.
Sholapur? That's your hometown.
Not exactly home, but I did my MBBS and MD from here.
It falls in Maharashtra.
Yes, it is Maharashtra, Southern Maharashtra.
Southern.
The other son is doing MD medicine in
Uh-huh.
Pune Busy Medical College.
Mm-hmm.
So final year MD medicine.
Good.
Oh, he will also be coming to cardiology?
I doubt. I don't think so. I don't think this is now good time to come into cardiology.
Yeah.
Yes. What do you feel, Dr. Ajay?
I think you should follow your interests. If you find joy in cardiology, you should practice cardiology. There is room for everybody
Everyone.
who enjoys
Yes.
this.
But don't you think there is saturation now in cardiology? Too much of competition.
Too
I
much.
think it's true for all specialties, sir. Don't you
True
think?
for all specialties. That is also true.
We
Yes.
can train about 30,000 postgraduates, and we have 1,20,000 seats in India. I don't know how we are going to train these people. It's really.
That's why they are bringing down the cutoffs to minus.
You get more postgraduates.
In South Korea, when they tried to increase the seats, all the residents went on strike, saying that we will not get quality training if you increase the seats. And there was a standoff between the doctors and the government for 18 months. There were no residents in hospitals for 18 months in the whole country.
Is it?
So, they were able to fight the government there. They're saying that this is a wrong step. You are spoiling training. But anyway, it's not for us to.
But ultimately,
It is
who
academic
won?
fields.
Who won?
I think
Always
they reached a
government wins,
compromise.
we cannot fight against government.
No, sir. I think they didn't win. It is a compromise.
Acha.
It is a compromise, and they haven't. Neither one of them has lost.
Acha. Okay.
The High Court has dismissed their case. Now there was a case against this reducing the rank for NEET PG. Supreme Court has simply dismissed that case.
Dismissed?
Yes.
IMA. Yeah. Acha.
Yes.
On what grounds?
But there
That
are no-
everybody
they are
is
court, they are
eligible. See,
accountable to
the
nobody.
eligibility examination is only MBBS. It is not the NEET PG. So the grading which they get in the NEET PG will not interfere with their qualification. The basic qualification is the MBBS. That's what the court ruled.
It is a short-sighted ruling, sir. In the rest of the world, unless you have an MD degree, you are not allowed to practice.
Practice.
If you are going to license somebody to practice, some basic minimum competence has to be there along.
Sorry, Dr. Ajay, I have
feel
to leave.
passionately about, so I should not speak.
Should I leave?
Right.
Meeting?
No, I think it's
Emergency.
just
There
nice
is
for
an
everybody.
emergency.
No, I have a physical meet here. Okay, I'm good. Okay, fine. See you.
Thank you very much for joining.
Thank you. Thanks a lot.
Aye.
Thanks a lot.
Aye.
Bye.
You will close, sir?
Yeah.
Sir, if you have any other anecdotes you want to share, otherwise we had a very nice 45 minutes or so interaction. It's always a pleasure to meet the
Pleasure.
pioneers.
Always a pleasure. Always a pleasure. It was so
And,
refreshing to see old friends. And seeing them doing good. Really, you feel your chest swells with pride. Your friends doing good.
True, sir. Now that the bond of PGI kind of cuts through everything and binds us across years and decades is very nice.
At our time, Nizar was from Kashmir. I was from down south in Tamil Nadu. And Parleji was from Maharashtra, middle. PGI always is like that. That time, there was only a central phone in one of these things. And if you go there, you will have to have a long wait. And each man will be speaking in different languages. There was no cell phone or other things. We had to go to that phone booth.
Central Post Office, yeah.
Yes. Anyhow, we had a good time. Thank you, sir, for your patience and other things. Thank you, Nizar.
Thank you.
Long time. I'm seeing you with a bird and other things also. Yes.
Sure.
Right, sir.
Right, sir.
Have a good day, sir.
Thank you, thank you,
Very
thank you.
much, sir. Thank you, Dr. Amuthan. Mahesh, we can log off now. Thank you very
Yes,
much.
sir.
Thank you, sir.
Thank you. Good night, everybody.
Good night.
Good night, sir.